John, the silver lining, or I mean the ray of hope maybe is a better description in all of this, was boosters and a rapid rollout of a booster campaign. Are you full of hope?
Not especially, because I see absolutely no evidence that this chief medical officer or this government have any interest in engaging in best practice internationally. I mean, you mentioned boosters. It was obvious from the Israeli data as early as July that boosters would be required. I mean, they vaccinated before everybody else. They realized immunity was waning, and they advertised in July of this year that they were doing boosters for adults. It's taken us another 6 months, effectively, to realize what was obvious to most of the rest of the world. The Americans picked up on that. The Britons picked up on that. Most countries picked up on that, but we didn't. And that's just part of a pattern. I mean, I think, Kieran, we are now talking about one of the greatest public policy failures in the history of the state. It's been 2 years. We spent €40 billion. We did €9 meals. We did mandatory quarantine. We closed schools. We shuttered businesses. We basically told people to sacrifice and winter it out so that we could summer ahead last winter, if you remember that. Now, Tony Holohan was on your programme and he was talking about his model, the NPHET model, which projects 5,000 cases a day at peak in December. Now, the United Kingdom, our nearest neighbour, which has no restrictions of any kind at all, had this wave once it reopened. They peaked at 38,000 cases daily, which is one case for every 1,390 people in the UK. The NPHET model projects that Ireland will have one case. This is their most optimistic model, remember. One case for every 990 people in Ireland. So apparently the virus, even with restrictions, according to NPHET, is going to be 30 to 40% worse in Ireland than it was in England. Now, I don't understand how they get that figure. And it's notable because earlier this summer, the reason we stayed closed when England opened up, if people remember, is because NPHET produced models which said cases were going to peak at about 70,000 total cases or something like that in early September. Those models were, and I hesitate to use this word, but it's the only word for it, they were garbage. We didn't come within a donkey's roar of hitting those numbers. And once again, we're being presented with this model, despite the fact that the last model was wrong, and this one makes no intuitive sense to anybody who can look at the figures anywhere else in the world. And we're being told that as a result of that, we have to wear masks indefinitely and non-pharmaceutical interventions indefinitely, and businesses have to stay closed indefinitely. So my question really for Tony Holohan is this, and I'm sorry if there's anger coming through in my voice, Kieran, but I'm bloody angry about it, is how is it that Boris Johnson, of all people, Boris Johnson, not exactly anybody's idea, I think, in this country of a great leader, can open his country fully and normally, but our people in charge, after 2 years, €40 billion, endless resources, cannot.
Because of a better equipped health system?
Well, this is it. I mean, look at the figures on the health system, Kieran. In 2018, the OECD produced 2 reports on the Irish health system. They found that we spend more per head of population than any country in the OECD, bar one, on health. And they also found that we had the 4th lowest number of hospital beds per head of population in the OECD.
Yeah.
So we spend more than anybody else. We have fewer hospital beds than anybody else. This is a result of successive governments being so incompetent that it is almost beyond description. How you can spend that much and have a health service that is completely unable to withstand what is a normal enough winter surge, because people seem to have forgotten that this is not a COVID story.
Yeah.
This has happened every year of my adult lifetime, Kieran, and every year of your adult lifetime, and every year of every listener's adult lifetime.
But John, and listen, when the government say, listen, we inherited the health service, I mean, they failed to point out, I suppose, I think there's 4 ministers for health who sit around the cabinet table, including the Taoiseach and the deputy Taoiseach, both former ministers for health. So they're kind of running away from their own fire to a degree. But that doesn't solve the immediate problem. You know, there's obviously an issue in how that money is spent. But the fact is, there's still not enough ICU beds, and we don't want a situation where somebody has a heart attack and they go to hospital and there's nowhere to care for them.
Well, if that's the issue, then part of the €40 billion that we spent at the very beginning of the pandemic was requisitioning private hospital capacity and private hospital beds. Why is that not on the table anymore?
Yeah, that deal is still there. There was a deal signed in January and it was a 12-month deal, so it still exists.
Well, I don't understand. I don't believe that they're using many of those beds, and I think that's something journalists should be asking about, because my information is that they aren't. But in any case, I think when we have apparently unlimited money to throw at COVID, at the beginning of the pandemic there was talk of emergency hospitals and emergency facilities and bringing in the defence forces to increase capacity in the health service and all of that. Apparently now all of those we're apparently still in emergency. We still have the Emergency Powers Act being extended over and over and over again, so the government still thinks we're in an emergency. But they have no duty apparently to solve it anymore. The only people who are asked to solve the emergency are the public or the nightclub owners. I mean, you and I are lucky, Kieran, that we don't make our living in hospitality. Imagine if you're somebody who is a nightclub owner who just last week was told, oh, you have to have ticketing facilities. They've invested all this money in making their clubs and their places compliant with what the government said it was last week. Then on Monday, Dara O'Brien, the housing minister, said 31 hours before restrictions were announced, there will be no new restrictions. And then yesterday they're told, sorry guys, you have to effectively close, but by the way, we don't have the courage to say close. We're just going to shut your doors at 12 o'clock, which effectively closes you down. I mean, it's a disgrace.
John,
there's no other word for it.